Okay, great. I'm going to start. I'm Dr. Kenneth Hayashida. I'm a board certified pediatrician retired. I've had licensure in California and Hawaii, and this is a Zoom call held on August 23rd, 2023 regarding multi-state responses to the needs of children, families, and schools from multiple communities in the emergency response to the Maui fires of August 8th, 2023. This Zoom call is for initial introductions between local leaders, educators, relief responders, and the National Center for School Crisis and Bereavement. I do want to make clear on the recording and for the state, just to state openly that this is a meeting that's sponsored by me as a community service for the people affected by the Maui fires and disaster. There's no governmental, academic, or corporate sponsorship for this meeting, and there's no financial or conflicted interest between myself, the sponsor of this call, and the parties invited to the call. So the goal of this call is to support response by local government, educators, and clinical teams to the Maui fires of August 8, 2023. There is a network of people responding to the needs of Maui kids and Ohana. That support could be augmented by noting resources from the American Academy of Pediatrics to help children, families, and schools cope and adjust after the disaster and other disasters like hurricanes hit. And I wanted to make a supportive gesture for personnel and resources moving to Maui and connect from Maui responders to the National Center for School Crisis and Bereavement. I felt like there was an opportunity to try to bridge some communication there, and that's what we're doing with this call. Want to network people, and so want to make sure that we're doing some introductions. I am a board certified pediatrician who had licensure in Hawaii and currently licensed in California. I retired from clinical care and many years ago, and am reactivating because my family is directly impacted. My cousins are from Lahaina and unfortunately have lost homes and business sites in the fire. And in the picture, you see my picture of Lahaina from a few years back, and some first responses from some teams here in Orange County. That's a team of women that pulled together a project very rapidly in Southern Orange County and San Clemente. And I'm not sure if Jennifer's on the call right now, but last I spoke with her, she was moving those supplies to distribution centers in West Maui. She flew out from Southern California to go to Kahului because she's from upcountry. And the other women that pulled that project together are from Maui as well. So with that, let me let each person introduce yourself. Your name and the organization you're with, and if you could say the organization and what your what your interests are. Let me call on Dana first. You're top of my list, so Dana, why don't you go ahead?
Aloha, thank you, Ken. This is Dana Moore. I'm a Maui born and raised nurse, and I have prior been involved with the very early efforts from the grassroots ground up pandemic efforts, and associated with people who are way brighter than myself working together in a task force. And so just letting you know that I've sent the message out to everyone off the top of my head. It was a big list, and those who did join in, I just thank you so much for responding to this call, and then we'll get this recording out to the rest of the list. And I'll put my contact info in the chat, and then you can reach me there, and I'd love to add you to our Hui. Hawaii
Awesome.
Health, Hawaii Health Cares Hui is the group that's forming, and we have rapid response things already in action. So I'll
Awesome.
tell you later. Thanks.
I see the Honorable Mayor of Torrance on, George Chen. George, you want to say hello? Thank you for coming on, Mr. Mayor. Really appreciate it. Oh, I think you're muted still. Let me, hopefully, yeah, there
I
you
got
go.
it. Can you
There
hear
you
me
go.
now?
Yes.
Oh, sorry about that. I just clicked the link and here I am. Just want to come and see what you guys are doing. Thank you for inviting me.
Thank you, Mr. Mayor. Mr. Kaji, John Kaji, Torrance City Councilman from Torrance District 1. My part of my family's in the district and lives in Torrance. So thank you for coming on, Mr. Kaji. You want to introduce yourself too?
Sure. John Kaji, City of Torrance, Council District 1. We have a very large community of former Hawaii residents living here in the Torrance South Bay area. And we have a fundraiser on September 9th here in Torrance. So we're looking forward to supporting the fire victims on the island of Maui. Thank you.
Thank you. Thank you, Mr. Kaji. Andrea, I think you're from HSTA. It's nice to meet you.
Good morning, Andrea Eshelman, Hawaii State Teachers Association. One of my colleagues reached out and asked via her daughter for me to jump on if I was available. Obviously, we're leading the immediate responses needed as to support the educators and students of the Lahaina area schools, as well as we have a few educators up country who are affected by the fires.
Ricardo, go ahead. And then I'll call Jason.
Mabuhay. Can you hear me now?
Yep.
I'm Dr. Rick Custodio. They call me Dr. Rick or Papa Rick. I'm a pediatrician and professor of health science at UH West Oahu. I've practiced pediatrics for about 40 years, all at community health centers in Kalihi, Bakelink, Big Island, and Waianae Comp. And I've also been a medical director for about 20 years. So I have a lot of health admin experience if you need it.
Awesome.
Just here to volunteer, whatever you need.
Thank you, Dr. Jason. And then I'll go to Cynthia.
Hi, my name is Jason Chang. I'm a pediatric dentist on Oahu. It's called Oahu Pediatric Dentistry. I'm friends with Dana. It's been kind of helping out originally way back with COVID, and we created a supply company. So I practice half the time, and then we have a supply company called Aiden Health that right now we have a commitment from MacBrite to donate 30,000 N95 respirators, and we're also trying to get Lee's been helping educate me, but like 3 MP100 so people can breathe air safely on Maui. But I'm just here to help.
Thank you. Thank you, Dr. Chang. Cynthia?
Yes. Good morning, everyone. My name is Cynthia Lalo, and I am calling in from the Office of the Mayor. I also have a colleague next to me, and I will let him introduce himself as well.
Aloha, I'm Joshua Cooper with Office of the Mayor, Office of Innovation and Sustainability. Thank you for reaching out and connecting with us, and it's great to partner.
Aloha, guys. Dr. Altenberg?
Hi, can you hear me?
Yes. Good to see you again.
Hi, thank you. I'm Lee Altenberg. I'm with the graduate faculty in ecology, evolution, and conservation biology at the University of Hawaii at Manoa. And I was part of the Hawaii Pandemic Applied Modeling Work Group and have been just trying to apply my population biology knowledge towards the Hawaii's pandemic response.
Great. And last but not least, Dr. David Schoenberg from the center. David, can you hear us?
Yes, I can hear you.
Awesome.
You can hear me.
Yes,
Yeah.
a little
So
soft, but I can hear you. Yeah.
Oh, okay. My name is David Schoenfeld. I'm a developmental behavioral pediatrician, and I direct the National Center for School Crisis and Bereavement, which is located at Children's Hospital Los Angeles. And we provide support, technical assistance, consultation, and training for schools and communities that have been impacted by disasters, as well as natural disasters, as well as school shootings, suicides, etc. So related specifically around wildfires, we provided ongoing support to Butte County, California after the wildfires there, Camp Fire. We provided support to Sonoma County, also to Tennessee after their wildfires. But we work with a lot of other natural disasters as well. And I'll just keep it at that. But we're here to provide any type of support we can to the school and the community. And I do want to say that we are able to provide some support at no cost, including covering our travel expenses for disasters because of the funding we get from the New York Life Foundation. So I just wanted to see how we could be helpful to you.
Yes, I really appreciate you in short order. I appreciate everybody getting on this call in short order. This was organized basically in the last 24 hours as a call to be able to respond as quickly as possible to any needs in Maui. And I'm going to flip back to 2 pages here. There is a AAP resource page for helping families impacted by relocation stress. Obviously, there's thousands of people that have had to relocate in West Maui. This particular URL, I'll put it into the chat, deals with emotional wellness and coping in families related to when there's a disaster and the family has to move. And it goes through a brief outline of ideas and steps that we can do as professionals to help. There is also a page at the schoolcrisiscenter.org. This is the center that we're going to discuss now. And I'm so grateful. I called in yesterday to find out if the center had any opportunities to talk about their resources with professional educators and the leadership team, both in Southern California for local governments and Hawaii that are being impacted. And I'm so grateful that we could get this call together in short order. So with that, David, do you want to talk about what kind of resources are available at your center and the history of where your center came from?
Sure. Let me give you a little bit of background also on the other things I'm involved in, because I can pull in resources through those groups as well. I'm on the executive committee for the Council on Children in Disasters for the American Academy of Pediatrics. So the website that you're describing that has resources, many of them are going to be resources from our website, because I helped the Academy put that together. It'll have some additional resources as well, but a lot of it will overlap. Noted that's why. I also chair the National Advisory Committee for Children in Disasters that reports to the Secretary of HHS and ASPR, the Administration for Strategic Preparedness and Response. And that's the group responsible for responding along with the CDC for disasters on behalf of the country. So I also have organizations, liaisons, and other people that I can pull on from that. And the last other group that I'll mention, which is managed by the center I run, is the Coalition to Support Grieving Students. That has 35 organizations, so I'm not going to go through all of them, but it does include among the American Academy of Pediatrics, for example. But I have already spoken to leadership from the School Superintendents Association, the American Federation of School Administrators, and other groups to see what connections they have in Hawaii. And I also did get contact with the National Association for Independent Schools. They have about, I think, 8 schools in Maui. So if we can help pull in resources from any of those groups or others, please let me know. I have already been contacted for people I worked with in Butte County who would like to help. They coordinate a lot of the response for recovery there in Northern California, but I can get in touch with wide range of people, so it's not just our center. So in terms of what the center does, as I said, we provide advice, technical assistance. We've been responding to crisis events for over 30 years. A lot of them are natural disasters, but they also include school shootings that you'll be familiar with. We coordinated the response for the first week in Sandy Hook. We coordinated the training for school crisis teams for New York City after 9/11. We've been working with public schools since the shooting at Marjorie Stoneman Douglas. So it's a very long list, and I'm not going to, but we can distill some of the learnings that we've had of dealing with disasters to try and help the school and the community figure out how to move forward by knowing a little more about what they might anticipate in weeks, months, or years, and some of the resources that they can draw on to be able to provide that, the best response. We do not provide, we're small centers, so we will provide on-site support, but we don't bring supplies and talk to all the students. So we really are more there for kind of systems level consultation. So as one last example, when the shooting happened in Mandalay Bay, I already knew people from prior trips and trainings that we had done in Las Vegas. So we met with people from the mayor's office to talk about how they could respond to their own employees. We met with people from the media there to talk about how to take care of their staff. We met with schools and began a partnership with Clark County Public Schools. And we worked on an ongoing basis with the Nevada chapter of the American Academy of Pediatrics. So we can work in multiple systems, but predominantly what we do is provide advice, some support to leaders, and training around behavioral health needs.
Mhm.
So I'll stop there, but you let me know what you might like help with or what questions you might have.
Thanks so much for that explanation. Are there, let me throw it open to the group for any questions that people may have on the call. And if you have a question, I think there's a hands up button, and just put your hand up and I'll call on you. Are there any questions right now about what the center does?
I have a question. Do we know if there's been any contact between the center and DOE officials here in Hawaii?
There hasn't been any. The only connections that I've had so far are with some organizations that are national organizations. And I did talk to one of the bereavement centers in Maui. We're also part of the National Alliance for Children's Grief. And so through that, they know me from those meetings, and they asked for some advice about what they might do through their bereavement program. And I also gave them some advice on how to reach out to the school, but we have not talked with others in Maui or in Hawaii yet.
Okay, thank you.
Mm-hmm. Is something that might be relevant to that question, David, is the discussion of the grief response programs for a school versus a district. Can you kind of give an elementary background on the differences between a district response versus a specific school site?
Okay, I think what you're referring to, kind of, was I talked about a program that we do along with the New York Life Foundation. As I mentioned, we developed the coalition to support grieving students. That was 10 years ago. And we have been, and that is open to anyone. It's online material, both video-based as well as print material. All of it is free of charge. And schools, individuals can access that information. There's actually a lot of material there. In addition to that, the New York Life Insurance Company started an initiative to raise awareness about the coalition to make schools.
Sorry, you broke up there. Can you repeat that, David?
Yep. Can you hear me okay now?
Yep. Go ahead. It broke up for a second.
So there was an initiative from the New York Life Insurance Company where they trained ambassadors, over 1,000. I don't really know the number anymore, but it's much more than 1,000. And the ambassadors go out to individual schools and they offer to speak with them, raise awareness about the issue of childhood grief, and make them aware of the resources. It's about a 20-minute presentation that can be done in person or remotely. And if the school then pledges to be grief sensitive, they receive a grant of $500. But that can be aggregated across districts. So we've been doing a lot of work with New York City Department of Ed over the years, but particularly since the pandemic started. So I know I did training for about 20,000 of staff and professionals in the New York City school system since the pandemic started through live presentations, most of them virtual. We're now doing some in person. That school district can get between $100,000 and $900,000 from New York Life Foundation if all of the schools become grief sensitive. If you have a very large school district, that money can be aggregated across the district. I mention that because the foundation is also trying to do a project now where school districts are becoming grief sensitive, and then we become involved, the National Center becomes involved to do a higher level of training, particularly for the school mental health providers, the crisis team members, the psychologists, the social workers, the counselors. And I just had mentioned it because talking to the vice president of the foundation, I would say 6 months ago, she said there was some interest in Hawaii becoming a grief-sensitive school district. Because as you know, Hawaii has all just the State Department of Education. So, but we had not yet arranged any of that training when this happened. So, if you wish that.
Oop, we lost you again, David. We heard you say "if you wish," and then we lost you.
If you wish, I can help activate that connection for that project, but our center can provide the training at no cost to you. So, and we can do that quickly. So I think if you were interested in the Grief Sensitive Schools Initiative, I would do it in parallel. I would start doing the training now for your leadership in the school about becoming a grief sensitive school district beyond that. Right now is
Go
really
ahead.
want to just start the work. Want to start the work as opposed to introducing it through ambassadors.
The timelines of when you see post-disaster effects of the stress on providers, educators, families, and the children, that's sort of what prompted us to try to organize this call in kind of a abbreviated fashion in the last 24 hours. There was discussion yesterday about us informally acknowledging the fact that if the behavioral support, if the mental health support and the social support is structured, then hopefully we can help people address those stressors in a healthy, more healthy fashion now. But that if it's not structured, that we could end up with provider stress, professionals being really stressed, and ripple effects from that. Am I getting that right?
Correct. So the only thing I will qualify it with is, and not to be rude, but no matter what you do, people are stressed and they will be stressed. So I don't want to pretend that if you put a good program in place, people are going to be okay with what's happened. It's a horrible tragedy. It's going to have an impact on the students and the adults. In large part, we find that the impact is even greater on the adults, because educators in these systems not only have their own personal impact, but they are also trying to take care of and attend to broadening needs of their students. And so the helpers tend to be the ones who are most distressed, to be honest. But that's a separate conversation we can have if you're interested. But what I will say is that you really want to start thinking about what you're going to be doing in a week, in a month, in 6 months, and even in a couple of years, because otherwise you're always in a crisis mode and reacting. And so you want to start thinking about what needs to be done, and then you want to divide those tasks up so that somebody is there thinking about a longer term program, someone's thinking about suicide prevention efforts, somebody's thinking about psychosocial support. So we work with schools on trying to figure that out. In fact, one of the other things I was doing today was we're working with New York City schools on trying to help them think through their asylum seekers program. So they're getting thousands of people from all over the world that are coming seeking asylum in New York, and they have to integrate them into schools. So I was going over the draft of their first back to school for kids that are from other countries seeking asylum. So, I mean, there are big issues that school districts need to take on when there have been crisis events. And I applaud them for stepping up to do it, but they really are not usually set up for it or resourced to do it. So we try and help them with that.
For Andrea, one of the things that I've been personally concerned about, because I have family members on the west side in Lahaina, who some of whom work at Lahaina Luna High. I've been wondering about how, or if either HSTA or Hawaii Department of Ed has some sort of support structure to bring the faculty and the administrators together for at least some meetings or some sort of interventions to help them socially and support them. So many of whom are, I'm sure, in the disaster zone themselves with their homes and their lives.
Yeah, I mean, if you want, I can provide you some general, just sort of statistics of what we're dealing with and kind of my own personal assessment of where things stand right now, if you feel that would be helpful.
Sure. Yeah, absolutely.
For the group, you know, this is not unknown information, but we have approximately 3,000 students that are in that school district. And then we have a little over 200 teachers, and then another 150 to 200 other staff members who are affected. For our members, high concentration of teachers live in the community. So of that 200 some odd teachers, about 150 are from the Lahaina zip code. And based on the information I have from other folks, same things can be said for the folks that work on those campuses and other capacities. As an example, the intermediate school principal has lost her home. The complex area superintendent has lost her home. And so we're experiencing sort of the double trauma of home loss, as well as for folks who are from Kamehameha III, the loss of the campus, and the impacts of the ongoing trauma of not knowing the status, not so much of colleagues. For the most part, I think colleagues are accounted for at this point, but the unknown factor of students. We received, I actually am meeting with the department later today, but we did receive official notice late last night from the Department of Education that staff will continue to be on administrative leave through the end of this week. And they are looking to stand up some sort of gathering for staff to come together, not at the campuses, because they are still trying to determine whether the campuses are safe. They're doing water quality and air quality testing. If you are interested, I can go pull it. There is a Board of Education meeting tomorrow at 1:30. If folks are really interested in knowing what's going on at the schools and kind of hearing from the community, and or you have concerns that you would like to put on the record, I would strongly encourage you to consider dialing in and listening to the Zoom. You can also go in person on Oahu, and then you can also submit testimony if it's something you feel strong about. We have been pushing that there needs to be a gathering of the adults, so to speak, to sort of as a starting place before they can even consider bringing children back on campuses. Of particular concern from our educators is the need to be provided tools, if you will, of how to deal with their own grief and their own trauma, as well as, you know, what do they do with their own students. You know, I've had conversations with members who are aware that they have students missing. I've had conversations with members who have asked me, you know, what am I supposed to do when kids come back? And they ask me, you know, where's Johnny or where's whoever, and that kind of thing. And so we are really pushing the department. That's why I asked the question of whether there was any connection there, because I am still trying to ascertain, you exactly what resources they have gathered or not. So we do know that a meeting is coming. We do know that they're having some kind of gathering. Obviously our focus is on teachers, but we have a greater sort of focus on the community impacts as well. We're doing things, everything from housing security, trying to make sure people have stable housing, to trying to determine, what other immediate needs are. And then as we transition, obviously, the longer term mental and physical health needs for folks. So that's just kind of the big picture stuff.
Yeah.
And if we can help you, we have actually written, I don't really like calling it this, but there's essentially scripts for classroom educators to read on the first day of class when they welcome students back. We did that for Connecticut after the shooting at Sandy Hook. We've done it for Marjorie Stoneman Douglas after the suicides that occurred. We've done this for a lot of different schools and districts typically after mass shootings, but we can also help do that after natural disasters. But that is a lot of what educators will say is, I don't know what to say. And what we often get is, if I don't know what to say, it's better to say nothing because I don't want to make it worse. And so I try and explain to them that saying nothing is actually the worst thing to do, because it kind of leads children to think they're either unable or unwilling to help. Those are negative messages for children to receive in a disaster context in particular. And they're not good messages ever, but they're particularly bad when they feel things are unstable. So we can certainly help with those, anywhere from those to the broader issues of kind of how can the system respond and I do also try and emphasize to people that there are multiple things going on now, but there are at least several categories. One is kind of basic needs. They need housing, they need shelter, they need food, they need communication. There are certain populations that are more difficult to access to provide those services, such as individuals who don't have documented immigration, seeking help, or even communicating with government agencies that are offering that support. But there are those basic needs, and I'm sure you have groups already on that. There also is the trauma of what happened. That will be most for individuals who experienced life threat at the time of the wildfires. People who were fleeing flames. We saw this in Paradise, for example. People were in cars and had to drive through a wall of flames and were afraid that they would die. That type of life threat is what's associated with post-traumatic reaction and post-traumatic stress disorder. But most of what you're going to probably be seeing is more in the grief side. It can be grief from death, which is bereavement. And I think it's unclear how many, at least it's unclear to me, how many children that will affect, because I think we still have a large percent of people that are missing, and it's not known how many have died. But most of what you're going to see is grief from other types of losses. Children who can't go back to their school, people who lost their home, their memories, their connection with their culture. I know there were cultures were destroyed. So there's going to be a lot of loss that's occurring. And I just want to caution people that the way we approach trauma is very different than the way we need to approach grief. And you will need to do both. And it will overlap in some children and adults. I can say more about that if interest, but
David,
I think it's an important distinction. Yep.
David, we've got a hand up in the room. The name on the screen is Susan. I'm not sure who's on that end, but please introduce yourself and go ahead.
Aloha, I'm Susan Picola Davis. Can you hear me?
Yes, go ahead.
Okay. I was invited by Dana. Dana and I have been working together for quite some time, progressively, and she sent me an email saying this.
Oh.
It's short and sweet. Can you still hear me?
The audio is cutting in and out, but go ahead.
Okay, I'm gonna take my picture off and then it'll be better.
Okay.
Let me know if it's
Yeah,
still breaking.
that is better. Yes, go ahead. Go ahead with
So
your question.
Andrea had
Yeah.
brought up
Mhm.
the Board of Education meeting, which is tomorrow. And I've already sent all the Maui Council members the link, and there's inside the agenda, there's already over 100 written testimonies from the teachers to the Board of Education right now. So many questions, which is telling me that Oahu is not talking to Maui. That's nothing out of the ordinary here. What Andrea said about testifying tomorrow is so important. I mean, I testified yesterday at the Maui Council, flew over, flew back. Tomorrow I'm going to be showing up in person at the Board of Education because the narrative is much different than what the actuality is from the board and from the department. And both of them have to take accountability for helping these people who are basically, as you said, grieving, but they are so angry. And there's so much anger because of the lack of response, the delay from the state, lots of delay. But the thing about Lahaina and the Maui people is that they didn't wait for anybody. They took it over themselves. They're doing, as a matter of fact, trying to organize it. The people had already, that was a week afterwards. The people were already organized.
Well,
Schools have to be clean,
Mhm.
which is what, if you could just read the testimonies, I don't want to say it all because I spent about, that's why I was late. Thank you.
It's okay, Susan. Thanks for your chiming in. Joshua, do you have any comments from your offices in Wailuku as to what kind of support the Maui County team needs? And do you have any feedback on the ideas that we're talking about right now?
Yeah, no, it's great to be on the call and great to be connected. We've been operating since Wednesday out there in Lahaina, partnering with and coordinating all the hubs to make sure the food is out, as well as also based on any needs that they need, also as well as making sure that the equipment is there and encouraging people definitely not to go inside the rubble. We've also been setting up sites to offer water, food, everything that is asked of, as well as hot meals with World Central Kitchen and Chef Hui. That goes from Buzz's Wharf, where the stop was before people got in at the beginning, all the way to Napili Park. So we've been partnering with community and people have just set up, and we've been coordinating that as well. The other side, of course, is not to forget is Lahaina definitely it's all gone, but Kula also was impacted with 19 homes, and they're just having their first day of school now at Kinke Kaulike today for freshmen and seniors tomorrow. So, you know, the fires were in 3 different spots on Tuesday. And since then, we've been operating to work with all 3 on just a luck part with Biden's visit. All of the King Kamehameha III teachers were all in one group. So then I took pictures of them with Jill Biden and said, hey, let's connect. And I have their phone number. So Andrea, if you don't have that, then it's, you know how it is. Sometimes we're all just in the right place and we can connect from there. I was taking in the Amazon AWS to set up communications and taking out Starlinks as well since Wednesday, so people could be able to communicate. We've been out with the county vehicles that can do megaphones to provide information. So we've been working also with Merriman's volunteers who actually also lost their homes. So it's really an example of what Andrea was sharing of people who have lost their homes, actually the ones being the ones giving everything back. We've also very much worked with the Kanaka Maoli. We organized Hiki Ana Lia to come from Oahu. And then we did the convoy of 7 trucks to bring all that in. And that's at Archikalepa's. But we actually have an entire network where we are coordinating it. We see it as community coordinated, government guaranteed. So it's with the people directly impacted, in control, listening to what they need, but then also connecting them with all the national assistance that's coming in and trying to be that bridge so that it's not just seen as a top down. So we've coordinated that during that time. And we thought this was an important conversation to have, especially going forward. And that's the side of really looking at expertise who understand their role, but then also want to partner with the people on the ground. So that's sort of how we are connecting and coordinating. I hope that's helpful. And schools are just starting up. Maui College is starting 1 week later. We've had World Central Kitchen operating out of theirs. I was thinking about even potentially teaching a course where actually we look at climate crisis and then have students involved in helping going forward. So I'd have a cohort of college students who are interested in these issues, assisting with firsthand information. But I just wanted to say thank you for reaching out, and then did our best to join the call, even though I know we'll have to run soon, and we'll be heading up country to Kula.
David, in order to engage your center on the ground in Maui or in Hawaii, what does your center need in terms of communication?
So all we would need is either an agency or organization that would like to meet with us and would like our advice. And I will tell you, like for Paradise and all of Butte County, a lot of our engagement started right over Thanksgiving. So the day after Thanksgiving, we started with the Zoom session, and then I was there on Sunday. So we can do it remotely. We can do it in person, but I just need somebody there who has a leadership role who says, yes, I'd like your help. We don't ever go to the site of a disaster until we've been invited. I think that's just disruptive, and I don't want people to feel that they have to somehow host us, coordinate things, have a certain threshold of activity that they can coordinate. So it can be as simple as somebody in the mayor's office would like to have you there for a couple days just to talk. That's fine, but it just needs to be someone, because I would never show up and become a burden. So that's all that we need. You don't have to apply for it. You just have to tell me, and we'll, I know at least I can come. I'm in Los Angeles. A lot of people for the center are actually on the East Coast, as we started at Yale. And so I'm the closest, and I could be there next week, anytime you want. But I just need to know that somebody would like me to be there.
Could I possibly provide some context just so folks on the call understand some of the dynamics?
Sure, Andrea.
So so I work for the teachers union, right? I was a teacher for 10 years, but just to give so people understand some of the context, if we're talking about schools in the state of Hawaii and we're talking about doing resources for those schools, getting into those schools and those resources have nothing to do with the mayor's office. It's all done at the state level, right? And so it has to go through the state superintendent. I am very thankful that I got this connection. I'm actually meeting with the department later today, and would be happy to pass along this information through our national organization. I've already gotten some other resources from the American Academy of Pediatrics and things like that we're passing on. And so I think being clear on sort of, there's the mayor's office and the community response, but if this group is very much interested in sort of the educational space, those connections have to be made, and I'll be happy to be that bridge for the time being, because I think anything that we can pass on to the department to help them figure out sort of what are the best ways. Like I've been taking notes, and this has been very, very helpful. Just to understand for your folks' context, right? That's all Board of Education at the state level, state superintendent, and complex superintendents. The mayor's office has no authority in the sense of like, that's not their kuleana, that's not their responsibility. They're handling sort of the community piece. And so just so folks kind of understand, as far as I know, mayor is not involved in that other than sort of the, you know, like we're waiting for like clearances of whether we can go back into schools, and there's lots of layers for that and things of that nature. But generally, as far as like dealing with the staff and the students, that's going to have to be there. Now, there could be community support set up for community members where they could bring their children, or they could come just as a member of the community, that is separate from the educational space. And that's absolutely welcomed as well, because I think parents in general are looking for options. And we also have parents who have children in private schools or parochial schools. For example, my understanding is the Catholic school burned down. So those parents are looking for resources as well. And so I think just figuring out the space that this group is really interested in pushing into, or in getting asked to be pulled into, just to give you guys some framework.
Yeah,
And
that's
just
true.
to
Yeah, and
build
Go-
on what
let me
Andrea
just-
said, in the Emergency Operating Center, the EOC, there are DOE representatives, and we've cooperated in multiple ways.
Joshua, your system went mute. Go ahead.
I was saying, to build on what Andrea was saying, definitely understanding where we're all operating from, but the Department of Education and people are in the Emergency Operating Center and have been meeting with people daily of what's happening and what's going on, and working that way. We've borrowed megaphones so we can go out and use that. And there's also a lot of education pieces coming on and going on out there on a daily basis, and definitely have a lot to take on here. So if Andrea is willing to be here on the ground and do those things, then that is fine, and we can continue. Also, sometimes people don't have access out there, and we facilitate that to make sure you can actually get on that road and do the things out there. So just so that we can coordinate together, that's all, and definitely willing to partner.
Thank you. I see a message from Mayor Chen that he has to step off the call. Thank you, Mr. Mayor, for being on the call. Really appreciate it. I think there were, go ahead, David. Yeah, go ahead.
like I said, so I appreciate the summary of the context of how the education system works in Hawaii, and that is consistent with what I've heard from other people. Please understand that we can work with whichever groups are interested. So, for example, after Hurricane Katrina, the school systems in New Orleans were not under a regular, Department of Education. And so we ended up not doing most of our work through the schools there, but we actually worked with the pediatric departments, clinics in the area, the family practice residency, community-based groups, FEMA, the Red Cross. So we can work with it at whichever group is interested. We've worked with archdioceses, if that's helpful for Catholic schools. We can work with community-based groups. It really is, there's a lot of need there. And I think what I would suggest is not waiting till there's like a formal invitation to collaborate with the State Department of Education. It's usually very chaotic after disasters, and it takes a while for people to be vetted and for there to be an organizational response that's coordinated. So really, for us to be involved, we just need to meet with a group. So in Hawaii, we went out and did training in Fort Tripler. We worked with and we went to Fort Hood after the shooting in Fort Hood, but we were brought in by communities and schools. So we'll go with whatever organization wishes our help and can coordinate at least something that they perceive to be useful that we can help with. So I think if I give the example of Sandy Hook, that shooting happened, I believe it was on a Friday. So within 24 hours, I was contacted by the teachers union because we had a relationship, the American Federation of Teachers, and we still do. And so they asked us to come out and help their members. That was from the DC office. Then they said, no, we're not sure what's happening. It's very complicated there. So cancel your flight. But I had a colleague, because I was at Yale for 16 years, who was leading the response to the Department of Education. So I went out just to help him, but by the time I arrived there that night, they had decided to let me lead the response for the school system. It's just, it's always very chaotic. There's often a lot of conflict. I know there was a comment about there being anger. Anger is pretty typical. That people get very frustrated. They feel out of control. They're trying to control, and it can be very, it can get very adversarial, and a lot of groups vying to kind of lead the response. So we do not need to lead the response. We have in some places. We don't need to do that. It's just I wouldn't go unless someone wanted us there and someone thought there was something we could do with value. But it can be through, I would say in Sonoma, I remember I talked to the American Academy of Pediatrics chapter that was in that area. And I talked to the pediatricians about how to support their patients. I did then work with the County Department of Education, and I worked with individual schools, but it really is up to you guys.
Dana, did you have a question? Not hearing you for some reason, Dana. I'm not sure why. I don't see the mute on either. Can you hear me? Yeah, I'm not
Oh,
hearing.
sorry.
Oh, there you go. Now I can hear
I'm
you.
signed in twice because I had to have two devices connected. So sorry.
It's okay.
Just because this is such a well-connected and informed group, I do have a question. And of course, the mental health and the grief aspect is one of the first things that I was on my mind. So I'm here to support in any way that I can. And please reach out to me and I'll do my best to connect and help facilitate anything. The other thing is, I was wondering if anybody who's well-informed, and maybe Mayor Bisson's office is, regarding the health and safety, especially with keiki, and I know some of them are meeting out, I've heard, I don't know, that something has been set up where there's some kids gonna meet outside, maybe somewhere near a beach. I don't have definitive info, but it started to get me thinking about the keiki and their health and the air quality. And I'm wondering, and it's not just keiki, I mean, all of the families. And I'm also concerned, and maybe a scientist here could speak to, is there concern for the rest of the island? Because for air quality and, you know, should we be all be wearing N95s or, you know, and then, you know, our HUI is starting up a free PPE line and can supply to anybody. So we want to get that word out there, and Dr. Jason Ching is really amazing. So I just, if anybody can answer my question, I will be, that would be really helpful.
Well, my answer to that is that it's obviously going to be dependent on how close they are to the burn areas, and prevailing winds make a difference, but all in all, Hawaii's air quality is really pretty good, provided you don't have eruptions going on over on the Big Island and the prevailing winds bringing the fog over. But in general, I think that for the families and the people trying to recover and being in those burn areas, they definitely do need the PPEs and the N95s if they're in the disaster response zone itself, which is why those zones are off limits to just the lay people. So we're coming up on 1 hour.
I just wanted to echo that.
Oh, go ahead.
What Kenneth said, just so Dana doesn't stress out, that it's a small space that we have definitely closed off. People aren't supposed to be in those, but we've also been studying as well. And we were watching the other tropical cyclones coming because that might blow up or then the ash would spread, but that did not happen. We also are saying if people are in those areas, they should have P100 masks. So we have lots of N95, but if people are really, really worried, it's the P100 that our safety officers are saying you should have with those and to get the little respirators you attach onto them if you're really, really concerned. But the truth is, where we've set everything up, no one is near the space of any aspect of ramifications of health. We did have a student activities on actually Sunday, and they were playing in the Peely Park, but it was communities coming together and creating activities for children. And so that did take place, and that's the farthest point from where the center is. So just wanted to reinforce what Kenneth said, and just let you know from our perspective that we've also been looking out for that, Dana, and considering all those aspects.
Thank you. I just wanted to mention that we are also including P100s in the being able to donate, and we're looking into air
Perfect.
purifiers and potentially Corsi Rosenthal boxes that take supplies, and but they could be easily assembled. And just putting it out that Lee Altenberg is very well versed in this. So he's an amazing resource.
For the people on the call, I think I'm going to download the chat, save it. We'll try and email that out as a group. Thank you to everybody on the call. It's a great introduction. I hope that we can follow up with the center and Dr. Schoenfeld's team to try to get them on the ground. If there is a capability to invite his team out in the next 48 hours, they could be on the ground within a week to have person-to-person meetings. And that would be, I think, David, if I'm understanding correctly, that would be as an introduction and to help professionals understand what kind of resources are coming in from the National Center that you run.
Yeah, I find it's good to have some in-person initial planning, and then also people you can then get to know people, and then a lot of it we can continue remotely, but I find it's hard to set that up remotely, and that's why it's sometimes good to be in person. I don't anticipate that you're going to be able to pull together every educator in Maui for a session at any point in the near future, but we can certainly start thinking through how to develop materials that can be used, how to train people that can do more training, how to help you think through the response. And then we'll stay involved for as long as you wish us to, and that can be remotely. So it doesn't, sometimes it's disruptive to do too much in person, but we can certainly be there to the extent you want.
And if
I
there's
think
anything,
that we should at least give Andrea a chance to touch base with the Department of Education, and maybe she can come back to us real quickly, because if she's got the inroad to open the door and she's got the Maui chapter, I think that she's going to be the quickest way to get the help on the ground. Thank you.
Yeah, sounds good, Susan. Thanks for joining our call, Susan. Andrea, thanks so much in short notice jumping on. To all the doctors on the call, thank you so much. And of course, Joshua in the mayor's office, thank you so much for the leadership. If we can do anything to continue to support the response, let me know. Thank you. Have a good day, everybody.
Thanks very much, everyone.
I should say aloha. Take care.
Bye, everyone.
Bye-bye.